Hawks, welcome back to Hawkcast. I'm your host, McKenna Kessling, and today I'm here with the nurse practitioner in our school.
Hello all, my name's Sean Marie Madziwa, and I'm a nurse practitioner at our newly opened Mount Lake Terrace High School School-Based Health Center.
Yes, we are here to talk about our school-based health clinic. And my first question for you is, if someone needs to use this resource that we have, how can they get started?
That's an excellent question. So there are a couple of ways. We have an administrative office, and it's on the second floor between the vending machines next to the trophy case. And we usually have a bright yellow sign sandwich board out there that says that we're open. We're trying to be there 3 or 4 days a week. And we have one of our clinic coordinators will be there, and she's there to answer questions, help you schedule appointments. We'll give you paperwork that needs to be signed by your parent or guardian so that we have the legal right to see you while you're in school. And then she can schedule you for medical appointments on Tuesdays or Wednesdays and for dental appointments on Thursdays. You can also talk with the school nurse, either Miss Jen or Miss Sherman, and they can also help direct you to get your appointment.
Okay, so as for parent permission, so if a student wants like birth control, but they don't want their parents to know, how would that go about?
That's another great question. So there are certain conditions that we do need your parents' permission for. That's mostly anything physical, for sports physicals, vaccines, general health. We do need your parents' permission. And we have a 4-page consent and registration document that will explain all of our processes. For confidential reasons, if you are 13 and older, which is most of the students here at Mount Lake Terrace, you do not need your parents' permission. That is actually state law. By Washington state law, you can access confidential services for 3 different reasons: for mental health services and for sexual and reproductive health. So that does include birth control.
Yeah.
So that is your legal right as a citizen of the state of Washington to access those services when you're over 13 years old and over.
Okay, and you mentioned mental health resources. So what would that look like here if someone felt that they were in need of that kind of help?
So the school district already provides some mental health resources through mental health counseling through a different organization, and you can access those resources either through your school counselor, or your teachers can also refer you into that resource. I am a different resource. I can do a different type of evaluation, more of a medical evaluation, and try to get you into services as well. It might be a little bit of a different pathway, but we are working towards developing easy access point, an additional access point for students through the School-Based Health Center. And then if your mental health counselor you're seeing wants to have you evaluated to have some medication, that is something that we could also help start you with at the School-Based Health Center. For that, we would need to talk to your parents and make sure that there's a safety plan in place if we think about starting meds. Meds are not always needed, but sometimes they can be really helpful.
Yeah. So with the medication, that would look like it would get started here, but then you would probably get referred out to another.
It depends on what type of medication and what's really going on. I am a licensed and certified nurse practitioner. I have a certification through a national association, as well as a license through the state of Washington, and I also have additional training in what's called psychopharmacology, which is a specific type of training specializing in prescribing mental health meds. So I took some additional training a couple of years ago. And I do also get support through Seattle Children's Hospital psychiatrists and other psychiatrists in the area. So I could help manage that, and then if we, depending on what you and your family and what your needs were, we could always place a specialty referral if it was needed.
Okay. How would this work if a student doesn't have health care?
So if a student doesn't have health insurance?
Health insurance,
yes,
yeah, I'm sorry.
That's a great question. So we here at the School-Based Health Center, we will be doing care at no cost to families. So if you do have health insurance, we will charge your insurance. But sometimes you may have heard about co-pays or deductibles. And if that applies to your insurance plan, we would not charge you based on for our services here at the school-based health center. And if you don't have insurance, that applies as well. We will not charge you. And that just is for the care that you get within the school in our little clinic building, in our little clinic room.
As far as like dental goes,
dental's only on Thursdays. We have a dentist. Her name is Dr. Galani, and she's wonderful. And so she and her team, her dental assistant, will be here on Thursdays. The same insurance program applies. So if you do have some dental insurance, we will charge your insurance, but we won't bill your families. And if you don't have dental insurance, then you can also get the care for no cost. And they have a little x-ray machine they can do to do dental x-rays. They can do dental cleanings, and they can do some simpler cavities and some other dental procedures. Now, if you needed a big procedure, that might be outside what they can do in our little room, but they can help refer you into one of our main clinics to get that care done.
And as for that, the health insurance would have to be figured out there.
For that dental program, if you're initially, this is what I've been told, if you've initially been seen at the school-based health center, then that no cost to families policy still applies.
Oh, okay.
But if you originally seek care outside of the school-based health center, that does not apply. So if you start with us and we refer you on to something that we can't do in our little clinic here at the school, then and it gets done within our larger organization, because we are sponsored by the Community Health Center of Snohomish County, and we have many clinics in the Linwood, Everett, and Arlington area all throughout the county. And so if you start at one of our school-based health centers and move on to one of our other dental clinics because we can't fully take care of you, then there shouldn't be any cost.
That sounds pretty great.
Yeah. It doesn't include braces.
Oh, no orthodontic.
No orthodontia treatment.
Okay. Yeah. Okay. And you mentioned earlier physicals and sports physicals.
Yes, I've been very busy these last couple of weeks with sports physicals, so that's something that we can do. So if you find that you need a sports physical, which you do need one every 2 years, they're only good for 2 years, you can make an appointment. You do have to fill out the registration paperwork and the sports physical paperwork through the school. Mm-hmm. We have all of that. We can give that to you at our little admin office by the vending machines, and then we can get you an appointment sometime in the next week.
And that sounds very useful and very convenient because it's all at the school. Mm-hmm. So even if you're registered with another hospital or organization, you can still use the school clinic.
Yes, definitely. I'm not here to we're not here to replace your primary, we call it a primary care doctor or your pediatrician. That might be a term that you're more familiar with. We're not here to replace them. We're here to help get you additional access. I know it can be really hard to get in to see your provider sometimes. Sometimes it can be 6 weeks, 8 weeks, and you have something you want to be seen right away. We can offer care alongside that. So if you injure a joint or your ankle, or you're having headaches, or you're having other issues in school or sports physical, eventually in the next couple of months, hopefully we'll have vaccines available as well. We can do all of that here, and we can, if needed, we can always send records to your primary care provider.
This seems like a very good resource. And
we started the school-based health center at Meadowdale High School, was the first one in Snohomish County. Yes. So we're very excited to be here at Mount Lake Terrace. And we've found that students really do utilize our services at Meadowdale, and the student response at Mount Lake Terrace, we've felt very welcomed, so we're very excited to be here. And if you have any other questions about what type of services we offer, you can please stop by and talk with me or with the coordinator for the school-based health center.
Thank you.
Thank you.
I highly recommend that you check out this health center for any of your needs, if your needs may apply. So thank you.
Yeah. Thank you for inviting me.
Hey, Hawks. Thank you so much for listening to this episode. If you'd like to check out any of our other YouTube videos, feel free to check them out. This is Hawkcast signing off.